your spirits up. Now we are going to talk about purine synthesis. Okay, keep your spirits up. Purine synthesis. Okay, we want to make two purines. Okay, straightforward: adenosine and guanosine. Purine synthesis. And I said you the initial rule: we want to make sugar first and then nitrogenous base. In pyrimidine synthesis, we made nitrogenous base, which is orotic acid, first and then added sugar. Here we'll make sugar first. So sugar, we already know that part. What should I start with here in purine synthesis?
Ribose 5-phosphate.
Perfect. Ribose 5 phosphate. Ribose 5 phosphate can be converted into what?
PRPP.
With the help of enzyme?
PRPP synthetase.
Perfect. PRPP synthetase. Now, we already have sugar with us, and this sugar has phosphate with it, right? So, we just want nitrogenous base, okay? Now, with some magic steps, a lot of magic happening here. You add all those things uh, which are needed for the synthesis of purine, and actually, apart from this is PRPP synthetase, right? This magic steps needs very important enzyme. So this is already an important enzyme which you highlighted. This magic step with you want to convert this PRPP into one product which is called as inosine monophosphate. We already made one purine here, but this enzyme is very important. That's a rate limiting enzyme for purine synthesis. You cannot afford to forget this enzyme. What is this enzyme? PRPP amido transferase. There are a lot of steps in between. We just want to forget this, okay? Because there's a, if you want to convert PRPP to IMP, there is like an intermediate step which is 5 phosphoribosyl amine, and then later on it can be converted into IMP. But for now, just let's remember this one: PRPP amido transferase. Okay, PRPP amido transferase, it's a rate limiting enzyme for purine synthesis. Okay, for purine synthesis, PRPP aminotransferase is a rate limiting enzyme. And of course, you might have other ingredients as masalas here. Okay, you add glycine, aspartate, glutamine, and folate here, and you make inosine monophosphate. Okay, now story after this is pretty simple. After you made inosine monophosphate, remember, we this is a nucleotide, so this nucleotide will have nitrogenous base, phosphate, and a sugar. You already know it has phosphate, you already know it has ribose 5 phosphate, which is a sugar. Nitrogenous base in this inosine is called as hypoxanthine. Okay, so remember, what is inosine monophosphate? So write this down: inosine monophosphate is nothing but hypoxanthine plus ribose 5 phosphate, which is a sugar, plus it's phosphate. So IMP, inosine monophosphate, is nothing but hypoxanthine plus sugar plus phosphate. This is going to make your life a lot easy. Okay. Now, if you made IMP, which is also a purine, okay, so we have three purines. We want to remember, we only know adenine and guanine. Okay, inosine is also a purine, but adenine and guanine are more important for us. So the next step is going to be a lot simple. We somehow can convert IMP into adenosine monophosphate and G, um, guanosine monophosphate. Okay, so here you are winning the race. That this is your three. We made inosine, we made adenosine, and we made guanosine. Okay, we made purines. Okay, adenine and guanine. Perfect. Now, this enzyme is again important, which is converting IMP into GMP. And the enzyme here is Oops. I am
Adenosine monophosphate
uh
reductase.
huh
Adenosine monophosphate reductase.
mm,
The
no, this is inosine monophosphate dehydrogenase. So the enzyme which can convert IMP into GMP is IMP dehydrogenase. This enzyme, this is somewhere here. Okay, this is a weird enzyme here which we don't even want to remember here. Um, so let's just now remember this one: IMP to GMP conversion. That's IMP dehydrogenase. Okay, the reason why this is important is, again, we have drugs acting here. And can you tell me a drug which can inhibit IMP dehydrogenase? Two drugs. One is mycophenolate, and second one is
ribavirin.
ribavirin. Very good, ribavirin. Mycophenolate mofetil, where is it used? See, it has to be an immunosuppressant, right? If somebody has interstitial lung disease, you may give them mycophenolate mofetil. Anywhere, if you have immune, if you want some immune suppression, steroid sparing effect, give them mycophenolate. Okay, you are not going to make purines, and you'll not make DNA, so maybe you'll not make immune cells, lymphocytes. So it has some immune suppressive. You'll not make B cells. So that's the mechanism of action of mycophenolate mofetil, which is an immunosuppression. Remember immunology, IMP dehydrogenase. Ribavirin is an antiviral drug. Where do you think we can use ribavirin?
HIV.
Uh,
Hepatitis C.
Hepatitis C, um, which we don't, which we no longer use. Ribavirin, it's now kind of second, third line drug. We now have very promising drugs for treatment of hepatitis C. I would be really, really impressed if somebody says me the name of those drugs which are right now used for the treatment of hepatitis C. Ladipasvir and sofosbuvir. Okay, there is a table in, I think, end of the microbiology, which says sofosbuvir, ladipasvir. You can also use sofosbuvir and velpatasvir. I had hard time learning these drugs, guys. So ladipasvir and sofosbuvir are now a drug. We now have a treatment of hepatitis C, or you may use sofosbuvir and velpatasvir for the treatment of hepatitis C. Somewhere down the line, second, third line, we may want to use ribavirin, okay, which is no longer used now. Another viral infection, we can use ribavirin, which happens as a lower respiratory tract. That virus can have lower respiratory tract infection in the uh, infants less than 1 year, more than 1 month. What's that virus? Which is kind of a season now. Everybody's getting that virus.
RSV.
RSV. RSV. We don't typically use often, but if the baby is too much struggling and less than 1 year, having respiratory distress, and diagnosed as RSV, we may use ribavirin. Okay, so ribavirin is Hep C and RSV. Mycophenolate, you just know that's an immunosuppressant. Okay, immunosuppressant. Okay, so that's ribavirin, and mycophenolate can block IMP dehydrogenase. Perfect. So one on the downside of mycophenolate, it can increase the risk of lymphoma. Okay, I wanna talk about this step and step above. So here, this is extremely high yield again. We also have some drugs which can inhibit broadly purine synthesis by blocking somewhere here. Okay, and those drugs are 6-mercaptopurine and azathioprine. Very important. I cannot emphasize this. Azathioprine. There is a very important interaction here. If you understand this, you'll be way ahead than all other people. Okay, 6-mercaptopurine and azathioprine. Remember, these are nucleotide form of 6-mercaptopurine and azathioprine. That means it is a phosphorylated form of 6-mercaptopurine and azathioprine. So I'm going to write here nucleotide form. Okay, and I'm going to explain that in a bit. Nucleotide form of 6-mercaptopurine and azathioprine. Okay, so you now know the mechanism of 6-mercaptopurine azathioprine. It's going to inhibit the purine synthesis, and again, that can be used as an immunosuppressant. Okay, immunosuppressant. Excellent. So we covered all the drugs for purine and pyrimidine synthesis. Okay, so these are all drugs, and this is the pathway. Now, what I want you to focus on, we made purines here. Okay, inosine, adenosine, guanosine. Now, somehow, this purines, let's say we are using that in the formation of DNA. So you made AMP, GMP here, and then you made UDP, CTP, TMP here. You combine pyrimidine, you combine purine, and you make DNA, right? Sometimes those extra nucleotides you made, purines and pyrimidines, will be extra, which will be left, okay, which can later on be degraded. So extra AMP, GMP, and um, thymine and cytosine, they'll all be extra, okay, so they can be degraded. There comes the uh, cycle of purine and pyrimidine salvage. Okay, now what am I going to just say now here? Ultimately, this can be salvaged and again be reused. Okay, but for now, just trust me, this is purine synthesis, and we'll move towards salvage in a bit. Okay, any questions in this chart? Purines and pyrimidine synthesis. Okay,